Did you know that some health exams recommended after the age of 70 can actually do more harm than good? It sounds strange, I know. But the truth is, not all medical checkups are helpful, and in some cases, they can even put your life at risk. What if I told you that some of the most common exams offered to older adults lead to false alarms, unnecessary stress, and even dangerous procedures? Today, we're going to talk about those exams you should avoid after 70 because some of them might actually harm you. Imagine submitting to an invasive procedure for a false alarm, or worse, undergoing a test that, instead of protecting your health, puts it in jeopardy. If you're over 70 or have loved ones approaching that age, this video is for you. Because what doctors tell you isn't always the best choice for you. Oftentimes, what seems like a precaution ends up being an unnecessary overload of tests that do not improve your quality of life. Modern medicine has come a long way, but it's just as important to know when not to act. Sometimes, the best decision is to do nothing. In this video, we'll dive into 5 health exams that many doctors routinely recommend for seniors over 70, but in reality, they can be harmful. These tests, though commonly suggested, can lead to unnecessary stress, false alarms, and even serious risks. What often isn't mentioned is that, as we age, certain procedures carry more risks than benefits. What used to be a preventive measure that worked well may now become a burden to your well-being. What we want to share with you in this video is evidence-based information that can help you make smarter decisions regarding your health. We want you to have informed conversations with your doctors to avoid undergoing unnecessary procedures that won't benefit you. By the end of this video, you'll have a clearer picture of which tests to avoid, how to better take care of your health, and how to stay informed without exposing yourself to unnecessary risks. If you've ever felt pressured to get a medical test just because it's routine or necessary, this video is for you. Don't let fear of the unknown make you rush into decisions about your health. We're here to empower you with knowledge to take better care of yourself, avoiding the traps of preventive medicine that don't always help. Number 1. The colonoscopy trap. Colonoscopy has long been considered a gold standard in preventing colon cancer, one of the most common diseases among older adults. However, after age 70, this procedure can quietly become more harmful than helpful, especially in people without symptoms or a family history of cancer. What many don't realize is that colonoscopy is not a simple test. It requires an invasive preparation process, taking strong laxatives to clean the colon, which can lead to dehydration and electrolyte imbalances. For an older person, this poses a significant risk, as it can lead to complications like falls, severe discomfort, or more serious health issues. This preparatory phase can be exhausting, particularly for those with underlying health conditions, increasing their vulnerability during the procedure. We also have to consider the risks associated with the procedure itself. Colonoscopy involves sedation and the insertion of a tube into the colon, which can cause side effects like confusion, dizziness, and, in some cases, heart issues. In older people, the effects of sedation can last longer than expected, increasing the risk of falls, accidents, and cognitive decline. After the procedure, older adults may feel weak or uncoordinated, which can lead to serious falls, fractures, or even hospitalization. When a polyp is found during the colonoscopy, patients often undergo follow-up treatments, like biopsies or even polyp removal. While some of these treatments may be necessary, others are unnecessary, especially if the polyp is benign and unlikely to develop into cancer. The risks involved with these additional treatments, including infections and complications from unnecessary surgeries, can outweigh any potential benefits. What once was a routine, preventative measure can quickly spiral into a series of procedures that do not improve quality of life and may even reduce it. Take George, for example. He's an 82-year-old man who's healthy and active, but was convinced to get a routine colonoscopy despite not having any digestive issues. During the preparation, George became severely dehydrated, and after the procedure, he felt confused and dizzy. Later that night, he fell and fractured his hip, leading to several months of rehabilitation. And the worst part? The exam found nothing of concern. His life was disrupted, and he experienced significant physical and emotional trauma, all for a test that provided no benefit. This is a common story. Many doctors still follow the protocols they were taught without considering the specific needs and risks of older patients. Medicine is evolving, and what was once seen as a routine procedure is being reevaluated, especially as more research shows the risks of unnecessary colonoscopies in older adults. There are now safer, less invasive alternatives, such as stool tests that detect blood in the colon. These tests are just as effective at identifying early signs of colon cancer, without the risks involved in colonoscopy. These stool tests are much easier to do, don't require sedation, and pose no risk of dehydration, confusion, or falls. The testing is simple and can be done at home, with results often being more accurate in determining whether further action is needed. These non-invasive alternatives are a great option for people who don't have any symptoms of colon cancer but still want to monitor their health effectively. As we age, the key to good healthcare is making smarter, more informed choices, not simply more interventions. More tests don't always lead to better care. After the age of 70, it's often better to say no to invasive tests that may not be necessary. By refusing some tests, you're not neglecting your health, you're being prudent and avoiding unnecessary risks. Sometimes, less really is more when it comes to healthcare. Number 2, the full body scan mistake. In the world of medicine, there's a growing trend to view full body scans, like CT scans or MRIs, as a foolproof way to catch potential health issues before they become problems. The idea sounds appealing. A machine that looks at your body from head to toe, uncovering hidden health issues before they even show symptoms. But after age 70, these types of scans can often do more harm than good. The reason is simple. Full-body CT scans and MRIs are incredibly powerful technologies. While they are excellent at detecting major health problems, they also find incidental findings, small abnormalities or harmless issues that may never affect your health. These incidental findings can lead to unnecessary follow-up tests, biopsies, and procedures that carry their own set of risks. Imagine you undergo a full-body scan, and it detects a small shadow in your lung or a tiny lesion on your kidney. Though these findings may not be causing any symptoms or health issues, the fear and anxiety these words trigger often push people to undergo a series of unnecessary tests, from biopsies to more scans, and even surgery. But the truth is, many of these findings are completely benign and would never have become a health problem. This process, called overdiagnosis, is particularly problematic in older adults. The emotional toll of worrying about something that may never develop into a real issue can be significant. Many seniors find themselves on an endless cycle of appointments, tests, and procedures, which can take a physical and mental toll. The added stress and anxiety can lead to worsened health outcomes, as the worry often outweighs the potential risks posed by the findings. For example, consider the case of Betty, a vibrant 78-year-old woman who had no health complaints and was active in her daily life. During a health fair, she took advantage of a discounted full-body scan. The scan detected a tiny lesion on her kidney, something so small it would likely never have caused her any problems. But just hearing the word lesion set off a panic response. Within a month, she underwent surgery to remove the lesion. Although the surgery went well, the recovery process was lengthy and filled with complications, and Betty's energy and vitality were significantly affected, all for a lesion that might have never impacted her health. This scenario is far too common. Many people, in their desire for peace of mind, turn to full-body scans, hoping to catch problems before they appear. However, These scans often lead to a cascade of unnecessary interventions, each carrying its own set of risks. The procedure itself can be exhausting, especially for older adults, and the physical toll of lying still for an MRI or undergoing the radiation exposure in a CT scan is not trivial. Even worse, the tests themselves can be invasive, requiring follow-up procedures that may do more harm than good. In addition, many insurance plans don't cover the costs of full-body scans unless there's a clear medical reason for them, which means many seniors end up paying out of pocket for the peace of mind they think they're purchasing. Unfortunately, what they're really buying is a ticket to a cycle of testing, unnecessary procedures, and stress, which can ultimately lead to a lower quality of life. The smart approach is to trust your body and focus on symptoms that actually matter. Rather than obsessing over shadows on a screen, it's better to pay attention to how you feel. Your body communicates with you through symptoms, and any noticeable changes, like unexplained pain, weight loss, or blood in your stool, are far more telling than a vague finding on a scan. In short, full-body scans might seem like a good idea, but they can lead to overdiagnosis, unnecessary procedures, and unnecessary worry. It's important to be selective with medical tests, especially as you age. If you're feeling fine, there's no need to subject yourself to invasive tests that could create more problems than they solve. Always remember that less is sometimes more, especially when it comes to your health. Number 3. The overuse of cardiac stress tests. For decades, treadmill stress tests have been considered a go-to method for detecting heart disease, especially in older adults. The logic is simple. Push the heart to see how it responds under pressure. But after age 70, this logic can backfire in ways many seniors don't realize until it's too late. As we age, our bodies naturally change. Our arteries become stiffer, blood pressure fluctuates more, and electrical patterns in the heart shift. These changes are normal and don't necessarily indicate heart disease. But when a stress test is performed, it may identify abnormalities that appear concerning but are actually a natural part of aging. This can lead to false positives, where the results suggest a heart problem, even when the heart is functioning properly. For older adults, this can result in unnecessary and potentially harmful follow-up tests, including angiograms, catheterizations, and even stent placements or bypass surgeries. These procedures are not without risks, particularly for seniors with other underlying health conditions. The complications associated with these interventions, such as bleeding, kidney damage from contrast dyes, or drops in blood pressure, can be severe, and recovery from surgery becomes more difficult with age. Take George, a 74-year-old retired bus driver who had no chest pain, no shortness of breath, and no fatigue. His doctor, just to be cautious, ordered a routine stress test as part of his annual physical. The results came back borderline, indicating a potential issue even though George had no symptoms. A few weeks later, he was referred to a cardiologist, and within a month, he underwent angioplasty for a blockage that hadn't caused a single symptom. Soon after the procedure, George developed a severe infection at the catheter site, which landed him in the ICU. Over the next 6 months, he was in and out of rehab, and his quality of life was never the same. This story is all too common. Many doctors still rely on stress tests to detect heart disease, but these tests often lead to false positives, triggering a chain of unnecessary procedures. For seniors, these tests don't always provide meaningful information and may only lead to more harm than good. As a result, leading heart specialists and geriatric associations now recommend avoiding routine stress tests for older adults without any symptoms of heart disease. Instead of pushing your body to the limit with a stress test, the focus should be on identifying symptoms that are truly concerning. If you don't experience chest pain, shortness of breath, unexplained fatigue, or dizziness, a routine stress test may not be necessary. Rather than relying on invasive tests, Heart health in older adults is best maintained through lifestyle changes, regular walks, balanced meals, stress management, and staying socially active. These simple yet effective practices will go a long way in supporting heart health as you age. Healthy aging isn't about chasing down every potential problem. It's about listening to your body and avoiding unnecessary procedures. You don't need to live in fear of heart disease or constantly monitor your heart unless symptoms appear. Instead, focus on staying active, eating well, and managing stress. Those are the true foundations of heart health after 70. In summary, cardiac stress tests can be useful in some cases, but for seniors who aren't experiencing symptoms, the risks of false positives and unnecessary interventions often outweigh the benefits. A symptom-based approach, focusing on actual signs of heart problems, is a much smarter and safer way to care for your heart. Number 4. The overuse of colonoscopies. Colon cancer is one of the leading causes of death among older adults, which is why colonoscopy has long been regarded as an essential tool for prevention. However, after age 70, many experts are questioning whether routine colonoscopies really provide any long-term benefits, especially in the absence of symptoms that would warrant one. While colonoscopies were once seen as the gold standard in detecting colon cancer early, recent studies show that the benefits of routine screening decrease significantly after age 70. The main reason for this shift is that colon cancer generally grows very slowly, and in many cases, polyps found during a colonoscopy won't develop into cancer during an older person's lifetime. The procedure itself is quite invasive and risky for older adults. The preparation for a colonoscopy requires taking large amounts of laxatives, which can lead to dehydration and electrolyte imbalances, especially in seniors. These side effects pose a real danger to health, making the procedure riskier than beneficial. Additionally, the sedation used during the colonoscopy can have a prolonged effect on older individuals, leading to confusion, dizziness, and, more dangerously, falls that could result in fractures or serious injury. When a polyp is found during the colonoscopy, patients often undergo follow-up procedures such as biopsies or even polyp removal. While some of these interventions may be necessary, others are unnecessary, especially when the polyp is small and has a very low chance of developing into cancer. The risks associated with these additional treatments, including infections and complications from unnecessary surgeries, often outweigh any potential benefits. Take Eileen, for example. She's a 78-year-old retired teacher who had clean colonoscopies at age 68 and 73. Despite having no symptoms and no history of colon cancer in her family, her doctor recommended another colonoscopy at age 78, just to be safe. During the procedure, her colon was accidentally perforated, which led to emergency surgery and nearly a month of hospitalization. Though Eileen survived, her recovery was long and difficult, and her energy levels were never quite the same. This kind of incident is more common than people realize. Often, doctors continue to recommend procedures that were effective when patients were younger, but they don't take into account the risks involved as patients age. More and more medical associations are now reviewing their guidelines to avoid the overuse of colonoscopy in older adults who don't have any symptoms of colon cancer. A safer alternative to colonoscopy is the stool test that detects blood, a non-invasive method that has a high success rate in detecting colon cancer early without the risks associated with colonoscopy. These stool tests are much easier to perform, cost less, and most importantly, are much safer for older adults. In short, the overuse of colonoscopies in people over the age of 70 can be dangerous and doesn't always provide the benefits that are expected. If you have no symptoms and your previous exams have been clean, it may be time to discuss other, less invasive options with your doctor to continue maintaining your intestinal health. Number 5. The overuse of routine cardiac tests. Concerns about heart health are natural, especially as we age. Cardiovascular disease remains one of the leading causes of death in those over 70, which is why many doctors recommend routine cardiac stress tests, even if there are no symptoms. But these tests might not be as helpful as they seem, and they can often be more harmful than beneficial in some cases. The stress test, also known as the treadmill test, involves walking on a treadmill while monitoring heart activity. The goal is to determine whether the heart can handle physical exertion. While this test can be useful in certain cases, after 70 years of age, the reality is that stress tests are often prone to false positives. This means they may indicate a heart issue, even when there is no actual problem with the heart. This happens because, as we age, our bodies go through natural changes in the cardiovascular system. The arteries become stiffer, and the heart doesn't respond to physical activity the way it did when we were younger. This doesn't necessarily indicate a heart condition, but it can lead to misleading results on the stress test. A slight change in the heart that is completely normal could be mistaken for a serious issue, leading to unnecessary and potentially dangerous follow-up tests, such as angiograms, catheterizations, or stent placements. For seniors, these procedures come with risks. Catheterizations, for example, are invasive and carry the risk of bleeding, kidney damage from contrast dyes, and even heart complications. Additionally, the recovery from these procedures can be more difficult for older adults, especially if they have other underlying health conditions. Consider the case of Harold, a 76-year-old man who was healthy, walked every day, and had no symptoms of heart disease. During a routine checkup, his doctor suggested a stress test as a precaution. The test showed an abnormal result, which led to a series of unnecessary follow-up tests, including an angiogram and angioplasty to open up a blocked artery. The problem was that Harold had never experienced any chest pain, shortness of breath, or other heart symptoms. After the procedure, Harold developed a serious infection at the catheter insertion site, leading to a prolonged hospital stay and months of rehabilitation. His quality of life was severely impacted, and all of this was due to a test he never needed in the first place. The truth is, stress tests can lead to more harm than good, especially for those who show no signs of heart disease. Many doctors are now advocating for a more selective approach to heart disease screening in seniors. Instead of pushing elderly patients to take routine stress tests, it's better to focus on symptoms that actually indicate a heart problem. If there's no chest pain, shortness of breath, dizziness, or unexplained fatigue, the test is likely unnecessary. Instead of opting for invasive tests, seniors can maintain heart health through simple, everyday lifestyle changes. Walking regularly, eating a heart-healthy diet, managing stress, and staying socially engaged. These lifestyle choices have a more significant impact on heart health in the long run than any routine cardiac stress test could. In conclusion, routine cardiac stress tests can be valuable in some cases, but for older adults who aren't experiencing heart-related symptoms, the risks of false positives and unnecessary procedures outweigh the potential benefits. It's crucial to focus on actual symptoms and take a more personalized approach to heart health. Prevention through healthy habits is the best way to care for your heart after the age of 70. Throughout this video, we've explored how some commonly recommended health exams for people over 70 can actually do more harm than good. While prevention is key, it's essential to understand that not all tests provide the benefits they promise, and sometimes, the best thing for your health is to avoid certain interventions. Tests like colonoscopies, full-body scans, stress tests, and others can jeopardize your health in ways that may not be immediately obvious. Invasive procedures, false alarms, incorrect diagnoses, and unnecessary complications are often the unintended consequences of these tests when they're not truly needed. Medicine is evolving, and practices that were once considered standard are now being reconsidered as our understanding of health improves. It's critical that, as we age, we make informed decisions about our health. Not all tests are essential, and sometimes the best course of action is to focus on maintaining a healthy lifestyle rather than subjecting ourselves to invasive procedures that could do more harm than good. Walking, eating a balanced diet, managing stress, and staying socially active are effective ways to promote heart health, colon health, and overall well-being. In many cases, less is more. It's essential to listen to your body and focus on symptoms that truly matter. The emotional and physical toll of undergoing unnecessary tests and procedures can often outweigh their potential benefits. You don't need to be constantly tested and monitored if you're feeling fine. Instead, prioritize healthy habits that can have a long-term positive impact on your quality of life. As we grow older, we must have the power to say no to unnecessary medical tests and procedures. Saying no doesn't mean neglecting your health. It means being proactive and cautious about your choices. Medicine should guide us toward better health, not become a burden that leads to unnecessary stress and complications. We need to be the architects of our own health and well-being. When you discuss your health with your doctor, don't be afraid to question whether a test is truly necessary. Smart prevention isn't about doing more tests, it's about doing the right tests, those that truly add value and protect your well-being. Don't let fear or pressure dictate your decisions. Take control of your health journey. If this video has helped you reflect on your health or the health of a loved one, please leave a comment below. We'd love to hear your thoughts and how you plan to apply these insights to your own life. If you haven't subscribed yet, make sure to do so now, so you can continue learning more about taking better care of yourself and making informed health decisions. Remember, taking control of your health is the first step to living a full and vibrant life. Thanks for joining us, and we'll see you in the next video.